A warm welcome to this episode of Easy Access to Healthcare for All, a program designed by the National Health Insurance Authority to bring you updates on the strides towards universal health coverage as a key mandate. One of the ways to measure the impact of health insurance is to examine how stakeholders are keying into the vision. For instance, how are hospitals implementing the National Health Insurance Scheme? What are their challenges? In this episode of the program, we shall visit the Federal Medical Center in Abeokuta to look at their NHIA clinic and how it is faring. This is in addition to our other segments on the program. Do keep watching for details. I am Aisha Muhammad Ahmed, your anchor. I will be back shortly.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
The program starts with news reports from the National Health Insurance Authority and the health insurance ecospace. Please stay tuned for the NHIA news updates.
O God of creation, direct and noble.
The National Health Insurance Authority, on Tuesday 21st February 2022, commissioned the new NHIA Kwara State Office. The event had in attendance top government officials alongside stakeholders across the health sector in Nigeria. While delivering his remarks, Professor Nasir Mohammed Sambo, Director General NHIA, said the move is part of its strategic infrastructural development process to build corporate offices for the NHIA across the nation. He added that over the years, the authority has spent so much on rent for state offices, but this move will help it to save resources as well as improve its corporate image.
As we all know, the challenges of frequent office relocation, quit notices, ejection without cogent reasons, and outright sale of rented properties by owners without notification have been a major hurdles that have been impeding our progress.
Also speaking at the event, Professor Ibrahim Gambari, Chief of Staff to President Muhammadu Buhari, commended the NHIA for its continuous effort in achieving its mandate and embarking on reforms that is putting it on a good trajectory towards the attainment of universal health coverage. Gambari further restated the support of President Buhari's administration for the NHIA.
This landmark event is yet another evidence of President Muhammadu Buhari's administration focus on the establishment and maintenance of critical infrastructure across the length and breadth of our great country Nigeria in order to address the needs of our citizens and legal residents. The Buhari administration is particularly interested in the health and well-being of its citizens.
Other dignitaries at the event were Senator Yahya Olori Egbe, Chairman, Senate Committee on Health, as well as royal and spiritual leaders. In continuation of his familiarization tour to critical stakeholders in the state, the new acting coordinator, Edo State Office, National Health Insurance Authority, Ehanire Theodore Osa, paid a courtesy visit to the Nigerian Union of Journalists Edo State chapter in Benin City. The meeting is aimed at strengthening relationship between the NHIA and the media, especially in the area of deepening awareness on NHIA programs to the public. Speaking at the meeting, Ehanire used the opportunity to sensitize members of the union on the authority's flagship program, the Group, Individual and Family Social Health Insurance Program GIFSHIP, designed to expand coverage to the informal sector of the population. He said the program was a part of the many reforms of the Director General of the authority, Professor Nasir Mohammed Sambo, and has received significant buy-ins across the nation since its official launch. Ehanire added that the program presents the prospect of driving the nation's health sector towards attaining universal health coverage in no distant time. Receiving the NHIA team on behalf of the union, the chairman, Mr. Elke Festus, who thanked the acting coordinator for the visit and pledged his support to the NHIA State Office in helping to transmit the message of health insurance to the good people of Edo State.
You are watching Easy Access to Healthcare for All. Like I mentioned at the beginning, we shall be accessing the implementation of health insurance by critical stakeholders. And in this episode, Federal Medical Center, FMC Abeokuta, is our subject. The healthcare facility is one of the topmost healthcare facilities in southwest Nigeria and one of the accredited healthcare providers under the National Health Insurance Authority, NHIA, of the federal government. How has it fared with the implementation of national health insurance? What gains and what challenges does it face? Let's find out in our next segment, Issues around the NHIA.
The Federal Medical Center Abeokuta has over 22,000 enrollees, and because of that, it has its own NHIA unit that caters for the needs of the enrollees on a daily basis. The hospital is accredited for both primary and secondary care. From the entry point where the verification of the enrollees are done, to medical records for registration and to assign hospital number, to the nurse stations where vital signs are taken, to doctors' consultation rooms, pharmacy, laboratory, and many others, the process here is fully automated. Dr. Adebi, the chairman NHI operations at the Federal Medical Center Abeokuta, narrates the processes involved in accessing care by the enrollees.
This area is essentially for primary care. So when they come, they will show their evidence of being registered under this facility. Then the admin people will verify that. Then they'll send them to the medical records who will register them, give them a unique number. It's also good to mention that this hospital is EMR compliant, electronic medical records. We don't use files. So patients are transferred from the admin to the medical records or health information management unit. So they are profiled, they are registered. Then from there, they send them to the nurses who will check their vital signs, also interact with them based on their nursing needs. Then from the nurses to the doctors. Then after the doctor might have seen, patient may need radiological services or laboratory services or pharmaceutical services. And for those that will need further care, so they are referred for secondary services within this facility. And that is of good assistance to our patients. It's not as if they go and access care elsewhere. It's still within our facility.
Bakari Oluwanifesimi is the Health Information Officer at the NHIA unit of the Federal Medical Center, Abeokuta. She further throws more light on the process of attending to enrollees for both primary and secondary care.
It depends on the HMO. We deal with different HMO, and so it depends on the HMOs. But the first step is if you're a primary enrollee, so you just have to come. Since you already choose FMCA as your primary hospital, as a primary facility, so when you come, you do your registration, you see a doctor as the general physician, that means at NHI's clinic here. Then you will be referred to specialists if there's a need for you to be referred to any specialist. And if there's a need for you to be referred to any specialist, that means you have to request for code to be able to access consultation wherever you are being referred to.
FMC Abeokuta is not resting on its oars towards meeting up with the ever-increasing demands of the enrollees. More importantly now, that health insurance has now been made mandatory for all Nigerians under the new act of the NHIA.
The hospital, like all other centers, is actually putting some things in place because we know that the number of enrollees will become more, people accessing care will become more, utilization will be higher. So in preparation for that, the hospital is putting some things in place in terms of personnel, in terms of facilities, so that when eventually this comes to reality, the hospital will not be found wanting.
From our own end, we are doing a bit of sensitization too. You see some enrollees coming and maybe out of relationship with them and say, is there any way my parents can be a partaker of this? I'm not sure. You can enroll them through gift ship and all that, explain to them, and then refer them to the state office, because it's the NHIA state office that handles gift ship and all that. So when we go for sensitization programs too, NHIA gives flyers and all that. So we also share that with people, and the informed ones, we tell them, like, don't be the only partaker of this. Make sure that your family comes in. It saves you in the long run.
The Medicine Supply Initiative of the NHIA is another attempt to solve the complaints of enrollees on the issues of generic and branded drugs, as well as shortage of drug supply. Many of the healthcare providers believe this will go a long way in bringing succor to the enrollees.
Federal Medical Center here, we have a strong enrollee base, and then we have several referrals. So if we use FMC as a case study, the level of consumption, for example, if you purchase drugs now, even if you buy drugs worth of 30 million, in less than a month, it is down. So if we plan and say for primary enrollees and secondary, and say within this period, this is what, but you have referrals coming in from as far as Lagos, out neighboring states and others, we cannot turn them down. So the process of restocking, as it affects procurement rules and all that, is a bit of challenge that we have as a facility, because you cannot just say, I want to take 3 million, I want to take 5 million and go and restock immediately, which private facilities may have that authority to do. So though we make provisions for emergency purchase, but it's not compared to the rate of consumption. So with the drug arrangement that NHI is bringing up, it's a very welcome development that we facilities are looking up to. Then it will also help checkmate a lot of internal issues across facilities. So it's a welcome development. We're actually eager, waiting for its full implementation by NHI.
However, the implementation of the health insurance scheme is not without its challenges at the FMC. The issue of charges is topmost on the list of problems being encountered by some of these healthcare providers.
I'll start just one example. Cesarean section under NHIA is a secondary care or secondary service. It's about 75,000 naira. Whereas in this hospital, in this facility, cesarean section for patients who are not under NHIA is 150,000. So invariably, for each NHIA enrollee that is operated on, that adds CS in this hospital, the hospital is subsidizing it by 75,000 naira. And what are we observing, or what are we experiencing? Most facilities outside who can do similar thing, but we even charge more than what we charge, like 250. Instead of making a loss, they now refer their patients here, that this is a government institution. Instead of bearing the burden of the additional, maybe that's almost 120 something thousand. So they push the patient to us. So invariably, I'm advocating that all these tariffs must be reviewed.
Sometimes enrollees themselves are part of the problem in implementing a social health insurance scheme.
One of the issues we have with the enrollees is that they like abusing the scheme. Then people also feel that they are removing their money into the scheme. So they feel that even when they are not sick, they can come to the center, especially during public holidays or on weekends. You just find people coming on Sundays, coming from the church, especially on Sundays, or coming from the Muslims too. They have the way that they too gather on Sunday. So they will just come to the center, father, mother, and the children. They are not sick. So they now feign complaints that I have this, I have that, so that they too just feel that they should get part of their money. So, and of course, we are well-trained personnel. If somebody is not sick, there's no way you can collect drug, no matter the way you have feigned the complaint. So, we've put so many things in place to reduce abuse.
According to the chairman, NHIA operations in the FMC, Dr. Debi, many Nigerians stand to benefit immensely from the new NHIA Act.
It's an entitlement of all Nigerians. We should be able to access qualitative healthcare services, no matter our status, no matter where we belong to, whether we're in the rural or urban areas, whether we are high up there or we are low there. So it's a welcome development. So there should be universal coverage, and everybody must be registered. And the government has done so much. So now NHIA has directed that each state must start their own program and now align it with what is obtainable at the federal level, so that by the time the state starts this, and probably the local governments too okay in, and the federal is doing well, so on the long run, most Nigerians will be covered, and there will even be more pool of fund to be able to, some disease entities are actually excluded for now. But once we have more fund, it will bring all those excluded medical treatments into coverage, and people will be able to enjoy the scheme more and better.
Thank you for staying tuned. Easy access to healthcare continues with our stakeholders segment. In this episode, we have the Southwest Regional Manager of HCL Healthcare, Pharmacist Olayinka Omoyeni. HCL Healthcare is a health maintenance organization working with the National Health Insurance Authority. Pharmacist Olayinka Omoyeni speaks on the composition of the HMO's office as major stakeholders under the scheme towards delivering effective services to enrollees.
We have different departments that carry out different functions. We have people that are involved with bills. We call them a claims processor. So what they do is a timely processing of bills so that the hospitals can be provided, basically secondary services. They also have in-house doctors and nurses. Like I said, I'm a pharmacist by training. So the doctors are the people in charge of ensuring that the services that are provided by the hospitals, they are up to standard. So what they do is they conduct, as it were, we call it quality assurance of the healthcare services that's being rendered by the different providers that's on the scheme. Then we also have a call center. So the call center is manned by our nurses. So what they do is that they ensure there is a timely approval of referrals. And of course, they also undertake to ensure that the referrals sail all the way through.
He speaks on the relationship between the HMOs, the healthcare providers, as well as the NHIA.
The NHIA is the agency that actually owns the program. So the HMOs are put in place to ensure that there's smooth running of the program. At least, as it were, satisfied with the hospitals that are using. The hospital, as it were, they are satisfied with the payment that they get. So we ensure that the objective of the scheme is carried out smoothly, such that there's a warm relationship between the hospital, the providers, and the HMO, which now makes the scheme a beautiful program, as it were. That way, of course, the NHIA, they are quite happy.
Pharmacist Omoyeni described the recent reconciliation exercise organized by the NHIA as a right step in the right direction, as it has helped to resolve many conflicting issues between the health maintenance organizations and the healthcare providers.
The reconciliation was quite laudable. It revealed to both, to the HMOs and NHIA that number one, there are certain assertions or claims made by HCPs that are not totally true. I say we got some we saw some figures. A secondary provider, let's say a secondary provider is a lab, for example, a lab, an optical center, a data center, filing that we are doing capitation. Common knowledge says that they don't get capitation. What they handle is fee for services. So now it was able to let us understand that some information are not getting to the right people, as it were. So then, truly, some bills are being owed. And some of those bills that were owed were due to not following the policies of the scheme. So it was at the reconciliation that we saw that, okay, you say I'm owing this much. Okay, where are the bills? Some of these bills were never seen by us. Some were missing in transit. So, but the beautiful thing is, it came, as it were, to also amend or mend the issue between the HCPs and the HMOs. Because HCPs were also able to see that HMOs don't really hate you, as it were, but there are certain policies that you also need to follow. So it's a laudable thing, and like I said, it made the scheme clearer to the HCPs, and it also made the scheme clearer to the HMO, because there are certain things we are paying for that we're not supposed to pay for, as it were.
He throws more light on the issue of codes request and why it is important to get it to avoid unnecessary delays which might affect prompt service delivery to the enrollees.
Patient A presents at hospital A, which is primary provider. The person has blood pressure issues, so that has to be referred to a specialist. Now, at the point of referral, what they're supposed to ask for is code for consultation. At the point, after seeing, now the specialist consults, ask for certain tests if required. They also ask for codes. Now, those codes are for the test, apart from the code for drugs. Those codes are necessary. It helps us to track progression of treatment. You want to know how many consultations that facility is handling in a year, how many enrolled that's handling in a year, then what is the installation of the drugs, what drugs are commonly prescribed, or what is the... So, we may have to, but the codes are also necessary because they also checkmate abuse. They checkmate abuse, they also checkmate waste. So, then really we have to live with more patient with us. Assuming we have a system whereby everything is automated, it becomes easier such that at the click of a button, they can easily request for a code is given to them and they can move on. But most of our hospitals, they have to rely on mail, and some of them will tell you that our mail is not going through, maybe network issue or power. So, but for now, just please understand with us, they're necessary.
That was pharmacist Olayinka Omoyeni of HCL Healthcare speaking on a range of issues as it affects health insurance delivery under the NHIA. Up next, your questions answered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled?
How can I get enrolled?
What are the channels of complaints for enrollees?
Okay, like I mentioned earlier, the routes of transmission. They can either walk into the office, that means they come in person, and we have offices across all the 36 states of the Federation. They can write. If they write to the Director General at the headquarters, it will eventually go back to their states. Like I said, they reside in a state, the facility is in a state, so we have a state coordinator. So they can write directly to the state coordinator by post, maybe hand delivered, or they could write through email. They could make telephone calls to the call center or the telephone numbers of the state office, and then through our social media handle, Twitter. Now we have a YouTube TV, and then sometimes even when we hold events, workshop and seminars, people come up and they lay complaints. So all of these complaints are actually collated, and we have what we call a monthly enforcement register, that even from the state offices they send to us over here, so those are mechanisms that we've put in place to ensure that the complaint handling system of the authority is intact.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
It is on that note that we end this episode of Easy Access to Healthcare for All. Universal health coverage is a destination that we can reach as a nation, and the new NHIA Act makes sure of it. Join me again next week for another episode of the program. Enjoy the rest of the evening.